You came to the right place. Data doesn't lie. The science behind the art of parenting. Hi guys, welcome back. This week we will be chatting about racial disparities in health. How your ethnicity or your race can influence or impact the diseases you are more likely to get, as well as the type of care you get when you encounter anyone in the healthcare facility. So grab a pen and paper, grab some tea or coffee. I have a hot cup of coffee, and let's dig in. I decided to talk about this particular topic this week because obviously Monday was Martin Luther King Day, and it was just right to discuss and dig into how your race influences the healthcare that we and our children get. And like many other people out there, I'm obviously a Black woman, but as many other Black and African Americans out there, we have encountered our own instances of overt and subtle racism, and I describe quite a bit of what I have lived, because I lived in South Africa for a couple of years before immigrating to the States, and I described quite a bit of what I lived in terms of racism in the book I co-authored, Beyond Challenges. Having experienced those instances of discrimination, as much as it pisses me off, I've come to expect it. I've come to expect that it will happen, because that's the time we live in. But even as I expected, I guess because I expected, I have cushioned an extra layer of fight and perseverance and effort with everything I do, just so that I can get the same thing that someone else of a different race would get with just the required effort and nothing extra. So I know this as I'm an adult. I can rationalize this. I know what I'm trying to achieve. But with a child, it's different. So I realize that as I raise my daughter, I'm having different emotions about this particular topic, and I'm structuring that conversation in my head such that I can have that conversation with her. But beyond that, beyond her on a global scale or on a national scale, how do we take care of each other? How do we recognize that it's still happening, but at the same time do something in our everyday life that can make somebody else's life better, somebody of a different ethnicity, of a different race, just feel like there's still good people out there. And I think that's where this particular conversation for me is going, right? So there's a lot of different diseases and a lot of different ways that healthcare is influenced, or the healthcare you receive, or the diseases that you're predisposed to are influenced by your race and ethnicity. One, you have no control over, right? Just by virtue of your race, there are things that you're at higher risk for. African Americans are at higher risk for high blood pressure, diabetes, things like that. Okay, that there's nothing we can do about. Let's take something like maternal mortality, women dying in childbirth. So Black children, American Indian children, and Alaskan Native children are 2 to 3 times more likely to lose their mothers in childbirth than white children are. So they're more likely to grow up without a mom. And the reason these women pass away are things that are easily preventable. And even when you're accounting for things, because you would say maybe there's a lower level of education or socioeconomic factors. No, all those things are accounted for, and it didn't play a role, or it didn't affect those numbers. And these women are still are more likely to die in childbirth. So those are staggering numbers. Those are scary numbers. And I can tell you that when I was pregnant, that sort of just played in the back of my head all the time. One of the things, actually, and I'll share this with you guys, one of the things that happened after I had my daughter, throughout my pregnancy, I didn't really have a lot of swelling of my feet. I mean, I had minimal, but nothing crazy. But after I had her, my feet were really swollen. And I was having a headache, and I couldn't quite I was like, well, I'm just post C-section. I'll be fine. It'll be okay. And I remember it, and I was like, no, Black women are more likely to die in childbirth. So don't minimize this. Go in and just get checked. And I went in, and my blood pressure was higher than it usually was. So things like that. So it's one thing to not know, but it's important to know, which is why we talk about it. So let's take a disease that affects children directly, like asthma. It occurs in about 8% of Caucasian kids and about 10% of American Indian kids. So there's only 2% difference in how prevalent it is between these two groups of children. But American Indian kids are 11 times more likely to die if they're hospitalized or during a hospitalization for asthma. So that's a pretty significant risk for that set of kids. Let's take the same disease. You have it occurs 8% in Caucasian kids and about 13% in African American children. Again, there's a difference in how the rate at which these kids are hospitalized. You're 5 times more likely to get into a hospital if you're a Black child, and 7 times more likely to die from asthma hospitalization than a white child is. So these are scary statistics. And of course, I'm giving you the numbers. I'm not giving you the numbers to scare you. I'm giving you the numbers to just make you aware of the fact that your race plays a factor in the diseases you're predisposed to, as well as your risk for complications. And there are many levels to addressing this, right? There is, of course, the fact that all people should get the same care and healthcare, and that doesn't always happen. And it's a problem that needs to be solved on many levels, on a national level, on interpersonal level, on many levels, on a systems level. And this conversation today is not going to solve that. This conversation today is about how do we make, as an individual, how do we make the person in front of us in the interaction we're dealing with, make that person not feel discriminated against by virtue of their race, ethnicity, religion, sexual orientation, whatever it is, whatever difference they may have from you. How do you interact with them on a human level and just be kinder? And that's what we're talking about today. So the tips I have for you today will come from, I'll split it into two sections. One, as someone who is providing healthcare and interacting with people, and as someone who is consuming healthcare, if you have to use the healthcare system. So as someone who is a consumer of the healthcare system, here's my first tip. Knowledge is power. Ask questions. Don't be afraid to ask questions. I mean, if you have a child, they will ask you why 1,000 times a day. Go change a diaper. Why? They'll ask you why until the explanation you're giving them makes sense to them on their level. So you ask questions until the explanation you're being given makes sense to you. Ask questions. Don't be afraid to ask questions. And when you ask questions, ask for, if the method in which it's being given to you, you don't quite understand, ask for a different method. Maybe you do better with pictures. But just ask questions. Don't be afraid to ask. Ask and ask and ask again. The second tip I have for you is this. You should advocate for yourself, because we have the saying in medicine, if you hear hooves, think of horses, because certain diseases present in a typical fashion. So when we see certain symptoms, our brain goes to a set of diseases we kind of have to rule off a checklist. But not everything presents the same way for certain ethnic groups. Like heart attacks look different in a Black woman than they do in the rest of the population. So again, knowing these little differences are important. So for you as a consumer, if you're experiencing symptoms and you are complaining about these symptoms, and we're progressing along a path of what it should be and it's not getting any better, advocate for yourself. Say that it's not getting better. I'm not getting better. I don't think something is wrong. Something is wrong. Serena Williams, I use that example a lot because she knew what a blood clot looked like for her in her lungs. And after having her daughter, she was in the hospital and she had one, and she complained to the nurses and they didn't quite believe her, but she kept advocating for herself. And when she got the CT scan, it showed that she had a blood clot. So know that even though a set of symptoms presents in a typical fashion for the general population, by virtue of your race or ethnicity, it may present differently in you. So just advocate for yourself. That's my second tip. Now, as a healthcare provider, someone who interacts with people coming into the healthcare system, my first tip for you is this: be human. Just be human. Whether you're the person who is answering the phone, on a mom who is trying to schedule an appointment for her daughter and she's called 10 different people, and she keeps getting put on hold and the music is playing and is annoying, just be human, be patient, be kind, listen. Or you're the person who is giving a terminal diagnosis to a family, be human, sit down, listen, talk to them, hold their hand, be present in what you're doing, because the system is scary. The system is huge, is hard to understand, it's complex, and we in it know how it works, but people who don't live and breathe it every day, it can be scary for them. And minorities generally have a mistrust for systems. So be human, be patient, be kind. The second tip I have for you is communication is key. And the same way I said for a consumer of the healthcare system to ask questions, for a provider of in the healthcare system, provide information in a way that the person in front of you can understand. Not in a way that you understand it, in a way that the person in front of you can understand, because they might understand in a different way. I'm a visual person. I receive information better if I see it. I can speak English, I can speak French. I don't speak Spanish very well, but I can understand it. But the point I'm making is the person in front of you may need an interpreter. The person in front of you may need pictograms. The person in front of you may just need time. The person in front of you may need someone else in their family to explain it to them. So just ask them how they would like to receive that information. Whenever I go to families and I'm talking about their baby, I would say, how do you want me to tell you this? I can give you a lot of information. I can give you bullet points. What information would you like to know? I can show you the pictures of the x-ray. What information would you like to know? And they tell me. Some parents will be like, tell me every single thing, all the numbers. Some parents say, just give me the big picture. So ask them how they want to receive the information. And those are really my tips for you today. I hope it helps you be a kinder human, be a better human, be a more present person. And I hope it just helps restore somebody else's faith in the fact that there's still good people out there. So have a good week, and I will see you next week.